Cocaine is a stimulant drug obtained from the leaves of two coca species native to South America, Erythroxylum coca and Erythroxylum novagranatense. After extraction from coca leaves and further processing into cocaine hydrochloride, powdered cocaine, the drug may be snorted, heated until sublimated and then inhaled, or dissolved and injected into a vein. Cocaine stimulates the reward pathway in the brain. Mental effects may include an intense feeling of happiness, sexual arousal, loss of contact with reality, or agitation. Physical effects may include a fast heart rate, sweating, and dilated pupils. High doses can result in high blood pressure or high body temperature. Effects begin within seconds to minutes of use and last between 5 and 90 minutes. As cocaine also has numbing and blood vessel constriction properties, it is occasionally used during surgery on the throat or inside of the nose to control pain, bleeding, and vocal cord spasm. Cocaine crosses the blood-brain barrier via a proton-coupled organic cation antiporter and, to a lesser extent, via passive diffusion across cell membranes. Cocaine blocks the dopamine transporter, inhibiting reuptake of dopamine from the synaptic cleft into the presynaptic axon terminal. The higher dopamine levels in the synaptic cleft increase dopamine receptor activation in the postsynaptic neuron, causing euphoria and arousal. Cocaine also blocks the serotonin transporter and norepinephrine transporter, inhibiting reuptake of serotonin and norepinephrine from the synaptic cleft into the presynaptic axon terminal and increasing activation of serotonin receptors and norepinephrine receptors in the postsynaptic neuron, contributing to the mental and physical effects of cocaine exposure. A single dose of cocaine induces tolerance to the drug's effects. Repeated use is likely to result in cocaine addiction. Addicts who abstain from cocaine experience cocaine craving and drug withdrawal, with depression, decreased libido, decreased ability to feel pleasure, and fatigue. Use of cocaine increases the overall risk of death, and intravenous use particularly increases the risk of trauma and infectious diseases such as blood infections and HIV. It also increases risk of stroke, heart attack, cardiac arrhythmia, lung injury when smoked, and sudden cardiac death. Illicitly sold cocaine is commonly adulterated with local anesthetics, levamisole, cornstarch, quinine, or sugar, which can result in additional toxicity. In 2017, the Global Burden of Disease study found that cocaine use caused around 7,300 deaths annually worldwide.